So I'm coming up 6 weeks post-surgery, and this is kind of like when the 6 weeks when I'm supposed to be feeling fantastic and great. But really, for the first, I don't know, 28 days of that time, I think I spent 21 days of it in hospital. It just seems to be constantly in and out. I'm now battling my 3rd infection, and I've had 3 admissions to hospital. Luckily this time around I've been allowed to do oral antibiotics, and it seems to be kicking in quite quickly. I'm still oozy, quite oozy a bit, but it is getting better. On my last hospital admission I ended up having to go back to theatre. My wound was so gaping and it was just oozing so much there was no way it was going to heal. So after much debate I did go back to theatre, where they trimmed the edges of all my wounds, cleaned them all out and restitched them, and also reconfigured my tummy button. Who could tell that a tummy button could cause so much grief? After theatre went well, I was fine, my blood clots caused no issues whatsoever. In recovery I did give them a bit of drama when my saturation levels did drop down to 60 and I had to be bagged, just like you see them bag someone on ER. They've come to the conclusion that they think that my body was just exhausted and it just didn't want to breathe. It was just exhausted. My body is exhausted. I'm exhausted, physically, mentally, everything. It's been such a long 5-6 weeks. One of the problems with having so many infections, well it's not so many, it's only 3, is all the antibiotics. So the antibiotics react with my warfarin, my blood thinning medicine. So I am back to fortnightly, every 48 hours having a blood test. Some days it's actually daily that I need to go in and have a blood test. So on top of having blood tests at one department of the hospital, having to see plastics in another part of the hospital, oncology at another part of the hospital, is starting to take its toll. I'm doing over 1,000 kilometres a week for all these hospital appointments, and I do get tired. There's not much of an opportunity to rest. Throw in our daughter Madeline's hospital appointments and it just seems to be that we're living there. Last Friday, while I was in having my blood tests, after it was 2 days post my last surgery, and I was still quite breathless, and they were trying to decide whether or not they should give me an injection of blood thinners as well as my pills for blood thinners, and I'm busy saying to them, no more injections, we'll be right. And she said, I just might bring up when they actually found your blood clots. So they brought it all up and stuff, and she said, look, I'm just going to pop round and see the doctor and see what he thinks, whether or not we should inject you or what we should do. And I said, yeah, that's fine. And I was just looking at my CT results, and sure enough, it says there 2 lesions have been found in my lungs, and I was a bit gutted actually. So it was kind of like home and email my oncologist and say, I've got 2 lesions on my lungs, what's the deal with this? Why has nobody said anything about it? And I was a bit pissy about that, but I was also kind of like, well, you know, he said, oh, he'll look into it, and he got back to me and said, no, I think they're okay. And then he came back to me and said, actually, one's okay, one I'm not so sure about. And so they've organised me an urgent scan, and this weekend I'm having a scan of my lungs to see if I have cancer in my lungs. So today, feeling a bit better about it. I have to admit that for the first 72 hours I didn't even tell my husband, I didn't tell anyone, I just sat on it. I thought, oh my god, my husband's over having a sick, drama-filled wife, family, everything. I think he didn't need to hear this as well, and I have told him now. And it kind of sucks, and yep, it might not be cancer, but you try and tell anyone that hasn't had cancer that it's not cancer. And for all the people that I have told a few, well not few lots, but a few people, and they've said, oh, you'll be fine, Sarah, it'll be all right. And I just think, oh my god, give me your crystal ball. I need one of those at my house. I'm so pleased that you're able to tell me that it's going to be so fine and all okay when we don't know until we've done that scan. So sometimes I know that they are meaning well by saying, oh, you'll be right, she'll be right, when in fact it doesn't work that way. So I just have to get on and work it out. Yesterday, I'd have to say, would be one of the hardest days since chemo, to the point yesterday where I could have easily have just walked in front of a bus. So thank God we live rural and we don't have any buses out our way, so I couldn't do that. Plus I can't top myself. I haven't finished writing my will, and I'm a bit of a control freak, and I haven't sorted out this and that, so that didn't work for me yesterday. I got so pissed off again last night, just with it all, that in fact I cracked open a bottle of champagne that I've been saving for the end, for when I walked out the other side of this whole bloody cancer trip. And I'm not supposed to be drinking on my warfarin, but I kind of like thought, threw caution to the wind and thought, stuff it. You know, if I'm going to die from lung cancer, I'm going to have bloody champagne if I want it. Well, half a glass later I couldn't drink anymore. I was as nauseous as anything with it, so it served me right. And the bottle of champagne went into a casserole tonight. So I'm a bit gutted with this all. If I try and get my head around it myself, is pretty big right now, and it may be nothing and that'll be great, but I am feeling quite low. And that's being absolutely honest. Everyone around me just sees me as happy, smiley, cheerful Sarah getting on. I tend to, when things like this happen, bury my head in the sand even deeper, and I've just thrown myself at anything and everything I can do to make positive changes around the hospital. And everybody says, "Hi Sarah, how are you?" "Yeah, I'm great, thanks." Yeah, everything's going great. It's just a bit of a wee infection, but she'll be right," kind of thing. But in fact, reality is I am absolutely crumbling inside, and I can't focus on anything, I can't do anything, I can't seem to be achieving anything right now, and it's just this absolute facade that everything's all right when really it's just absolute bullshit. Where to from here? I don't know. I need to just get over it, eat some shingle, I don't know. I'm sick of just trying to do it, and I know I'll have to. But we'll wait and see what the results are and see what happens. In the meantime, I don't know. Day by day, no more drinking.